What are bone formation markers for osteoporosis? Imagine trying to understand how your bones are doing from the inside out. Bone formation markers are like tiny messengers that tell us how actively new bone is being built. These markers are substances released during the process when osteoblasts, the cells responsible for making new bone, do their work. They help doctors see how fast or slow your bones are forming, which is especially important if you have osteoporosis. Osteoporosis is a condition where bones become weaker and more prone to fractures, so knowing how your bones are remodeling can guide treatment decisions. One of the most important bone formation markers is called procollagen type ion terminal propeptide, or P1NP. This substance is a byproduct of type I collagen production, which makes up the majority of the bone matrix. When osteoblasts produce new collagen, P1NP is released into the blood. Because P1NP is stable and less affected by other factors, it is considered the most reliable marker for bone formation. Doctors can measure P1NP in a blood test using special immunoassays. It helps monitor how well treatments for osteoporosis are working and can even predict how quickly bones are forming. Another marker is procollagen type IC terminal propeptide, or P1CP. Like P1NP, it comes from collagen synthesis but is less commonly used because it can be influenced by other hormones like thyroid or pituitary hormones, which can make interpretation trickier. Bone-specific alkaline phosphatase, often called BAP, is an enzyme produced by osteoblasts that helps in mineralizing bones. It breaks down inhibitors that prevent calcium deposits in bones. BAP was one of the first markers used but has been somewhat replaced by P1NP because it can also be produced in other tissues, making it less specific. Osteocalcin is another marker secreted by osteoblasts. It plays a role in mineralization and calcium regulation in bones. While it can give clues about bone formation, osteocalcin levels can vary due to factors like circadian rhythms or other tissues, so it's considered less specific than P1NP or BAP. In clinical practice, these markers are used alongside measurements of bone resorption markers to get a full picture of bone health. They provide insight into the dynamic process of bone remodeling, which bone mineral density tests alone cannot fully capture. This is especially helpful for diagnosing osteoporosis, assessing fracture risk, and monitoring how well treatments like bisphosphonates or anabolic agents are working. Changes in bone formation markers can often be seen earlier than changes in bone density, allowing doctors to make timely adjustments to therapy. It's important to remember that various factors can influence these markers, including the time of day, food intake, kidney function, and the specific laboratory tests used. Therefore, healthcare professionals interpret these results carefully, considering the whole clinical picture. In summary, bone formation markers like P1NP, bone-specific alkaline phosphatase, and osteocalcin are valuable tools for understanding bone health. They help us see how actively bones are being built, complement imaging studies, and support personalized treatment plans for osteoporosis. Always consult your healthcare provider for interpretation and advice tailored to your individual health needs.